Started.
Ooh,
Okay.
all right.
All right. Well, welcome everyone, and thank you for joining us here today. I'm Marty Benson, and I have been asked by Amanda to chair the foundation annual appeal again this year, and it's the least I could do. So, welcome aboard to all of you. And we've got like one, two, three, four, five or six right now, and hopefully to get a few more on board. But I just want to thank you all for making yourselves available to help what I think is a very worthwhile campaign. For some of you guys, you've done it for years. Others might be new. Last year, just as an FYI, we raised $594,000, so well over $500,000, and we educated, uh, let me see, for a total of 300, or excuse me, 30, almost 36,000 individuals, families, children, and adults in the Sauk Valley area through education of over 18,000 people and physically assisting with medical assistance, 16,700, and then had over 800 screened for different types of medical conditions, if you will, in the Sauk Valley area. So again, we were able to support almost 36,000 people with the funds that we raised with last year's campaign. And again, our campaign, because of our fiscal year, we start May 1 as the hospital's fiscal year ending April 30. So that's why we call it the 25 campaign, but it really is a 25-26 because it goes
Right.
through April of next year.
Right.
Let me see. I just wanted, we have different chairs for our divisions. Susie Perino is not able to be with us today. She would be our business division chair. Amy Downs, who is here, is our clubs division. And as I said, I am kind of the community chair and over kind of the over general chair. And in addition, we have Dr. Marcia Jones and Dr. Nancy Tran, and they are our medical division co-chairs. And Laura Leal and Jen Grobe are the employee division co-chairs. So we've mixed it up and spread it among different areas of the community. And then we have different individuals that are chairing that, but we're all under the umbrella working together to raise, oh, which is a good point. Here's what we're looking to raise. We are looking to raise $600,000 this year, which would be a little bit more than a 10% increase over what we actually raised last year at the 594. But it turns out we already have a good start. We're over $100,000, $101,500 so far. So we're just starting, but we're still
Things are going good.
things are going well.
Yep.
I'm going to have we've looked at, we're on to
Screen
we
two.
are on
Yep.
screen two. Okay, we are here.
Yep.
Which would really be this one.
Oh, I'm on.
You're
Well,
on three.
There we go.
Yeah.
There's two.
Okay, and that just shows again the chairs of our of the different divisions of the foundation campaign this year. And on our next screen,
Sorry, I was
That's
I
okay.
was admitting a couple people.
well, and see, you're
Okay.
multifunctioning, and that's
All right.
important.
Okay, so our next screen.
Okay, and whoever has just joined us, I was just introducing myself and the division chairs, Marty Benson, and of course Amy or Amanda is right here, and just going over that we raised over $594,000 last year. Our goal is a little bit more aggressive this year, another $6,000, taking our goal to $600,000. But we're hoping to achieve that goal, and are at a good start at $101,500 to date. So that's wonderful. You'll see on the right-hand side, and it looks like our not looks like our kind of campaign theme is your health, our cause, and just showing that we help all aspects and individuals in the community with different types of medical concerns and keeping them healthy. And this shows on the right-hand side 2 on 4, 6, 8, 10, 14, maybe
15. Yeah.
15 of the different initiatives that we are supporting in this year's campaign, and we'll be talking about majority of all those, in the next few minutes to give you a better understanding as to where our dollars are going.
So our first program that I wanted to talk about this year is Women's Health. These ladies are two local ladies that we helped last year. Shauna Dingus from Amboy, she's 51, and Jen Grobe, age 43. She's from Polo. Both these ladies had breast cancer, and it was detected because of our free mammograms through the hospital. We were able to provide them education through our Breast Health Navigator. We provided meals, we provided their comfort bags, help with their treatment. These are just two ladies that are near and dear to our hearts that are just a sample of people that we helped last year. We helped a total of 451 women last year in this program, and we just love, I just love these girls. They're both, Shauna's a basketball coach and her husband is a basketball coach. So they are friends, but also rivals, and went through this journey together, and we helped both of them. So that's their story. Another program that I'm so proud of is our pediatric mental health program. And Amy's going to talk a little bit about that because I know that that's one of her favorites.
So you might get some questions from the people that you're calling and say like, well, what are you doing for kids? And this is a great example of something you can expand on to say, this is how CGH Health Foundation helps our kids in our community. So we partner with Cinecipi, and they provide counselors within each school, elementary schools, middle schools, high schools, and they provide 30-minute counseling sessions. And so where does CGH Health Foundation come in with that? Those people that can't afford those sessions, that's not paid through their insurance or through the state of Illinois, we help supplement Cinecipi so they can still meet with that counselor and get those services within the school. And so we're really proud to partner with them and help all of our kids in our school with things they're struggling with due to trauma or due to things that are going on in their life, and they need a certified individual to help them with that.
Thank you, Amy. Our next program is our Dementia Project, and I know all of you have heard a lot about that for the last about 3 years. On your screen is a testimonial that we received about this program. Blessings in all you do to make this journey as smooth as possible for those of us in it. We are very grateful to the CGH. We are very grateful the CGH has found it necessary to provide such a service to the community at large. We have helped over 425 families so far in the last 3 years. And I'm sure you're all aware, I hope you are, we opened a dementia respite center this January 29th. These are 3 pictures of the guests that we have there. Right now, we meet 1 time per week for 3 hours, and we currently have a waiting list of 11 guests who want to join. And so we're in the process of expanding this program. We hope we need to move into a larger room at Bethel Church, which also means additional time for our coordinator and more rent because of the bigger room that we need. But this program has just been such an amazing, rewarding, just wonderful thing going on that I'm so excited that after just 6 months, we have to work on expanding this. So besides our Dementia Respite Center, we also still have Beth Stirk, our Dementia Navigator, who helps families, navigate that horrible, horrible journey with dementia. And then we've been in nursing homes providing sensory items. We host WITS Fitness here at our office to help prevent dementia. We also host Jerry Fit, which is a fitness class that also can help prevent that. And we're just really proud of this project. So
we are talking about medical assistance as another one of our programs. We've been doing this for I don't know if it's a decade now, a
Forever.
long time, yes, where we are able to provide a 30-day or a 1 month supply of medication to patients who otherwise may not afford it. And this is so important. It becomes a critical barrier to patients if they're not able to manage their health through their medications, and often that times that's sometimes because of lack of knowledge or lack of ability to get the medicine or to pay for the medicine, and we are able to provide this assistance without interruption. So what happens is in the first 30 days of treatment, we have staff members that help the patients get enrolled in national programs to help them with the cost of the medication moving forward. So in essence, it's kind of like seed money that we're giving to the patients, that they're able to get the medication that they need upon discharge or just meeting with their doctor. And if they can't get going forward, we can kind of help navigate other opportunities that would help them so that they could continue to lead a healthier life by being able to get the medication that they need. And last year, I noted that there were 57 different patients that we were able to help, and filling over 160 different prescriptions. So this has been in our arsenal, if you will, for quite a few years, and it's still very, very, very important, and we're proud to be supporting of it. Our next screen, we're talking about our cardiac and workplace wellness, and this is kind of where we'll see us out in the community. And heart disease is the leading cause of death in the Sauk Valley area, and the foundation, we're committed to helping prevent heart disease through affordable cholesterol, blood pressure, glucose screenings, and our health transformation program, which is I can touch on that in just a minute. We have cholesterol screenings in businesses, and also primarily in businesses, and do they come here
They
ever?
come here to our
Right,
office,
okay,
yeah.
and we can offer the screenings at $30, which is it's much less than the cost would be if the patient were to try to have that in a public place or pay for it completely on their own. And this health transformation program is offered, and it's at $150 for
An entire year.
a whole year, okay.
Yes.
And in the picture here, we have an HTP participant, and her name is Mary Booker. And I'm understanding that through the program, she has lost 50 pounds and lost 50 pounds, and she's now no longer using her walker.
She lost her walker, yeah.
for her,
So
and
she's thrilled.
And she says she feels healthier than she did 20 years ago. So another program, that is kind of showing what we're trying to do is keep people healthy, keep them out of the hospital, and in any way that we can. So that's kind of why we're all here. In the last fiscal year, we helped 116 HTP participants, or they participated in the program, and 287 people received screenings, cholesterol and glucose screenings. So well over like 400 people that we helped in those two areas. So we're very proud of that.
All right, next up is our transportation. So our whole cause behind this is providing transportation. We don't want that to be a barrier for someone who needs help with either further medical assistance or routine care coming to the hospital. So we've helped 392 patients by paying for their basically transportation to and from the clinic or the hospital. And so we partner with D&L Cab Company, Pastor Home Nursing, and Whiteside County Senior Center. We also provide gift cards for gas cards for those that have their own car but maybe struggle filling up the gas tank. We don't want that to be a barrier as to why you're not staying healthy in our community, is because you can't get to the hospital. So that's our cause on our transportation assistance program. All right, next up, if you have someone asking again about kids, we partner with the YMCA through a program that's nationally renowned called CATCH, and that stands for Coordinated Approach to Child's Health. And it's all about teaching our kids great nutrition, information, and physical activity, how to stay healthy and, impacting their health while they're young, starting them early. Knowing that fruit snacks aren't really part of the part of the pyramid of the triangle of when you're eating. So they're providing great information for our students on how to stay fit and active and eat healthy. Some of them even come home and tell their parents a little bit about what they should and should not keep in the cupboard. My own kids.
And
So,
ketchup is not a fruit either, right?
no, ketchup is
Oh,
not.
okay.
So sorry about that, Marty. You got to
Mhm.
take that out.
Okay.
So that's our Catch program, which really works on nutrition and fitness with schools across our area. And who doesn't love dogs? And so if you're trying to make a call and you know someone who has a dog or has been impacted by a dog in their life, you can really talk to them about our therapy dog program, which has come back since COVID, and we have 6 dogs. They've done 1,600 visits, so that is remarkable. That we have that many people that are volunteering with their dogs in our emergency room, in our hospitals. And so we did have Chris Ratcliffe, who is one of our dog handlers. Her dog's name is Samson. And he had a story where during one of his visits, he gently approached a patient who wasn't feeling well. He climbed onto her bed and they stayed close for nearly 20 minutes, and the patient was completely content. It was one of those moments where the presence of the dog brought the real comfort, not just to her, but to everybody in the room. And so they make a world of difference in our hospital and our clinics. And so our therapy dog program is just one of the ways that we reach out with CGH Health Foundation.
Thank you, Amy. So on to the nitty gritty here. So when are you going to get your list? Sierra and I are working on them currently. We hope to email the list to you in late June. We will email your contact sheet to you just like we have in the past for those of you who have helped us before. It'll include their address, their email if we have it, and a telephone number for you. If you notice any of that information is incorrect, or if somebody has possibly passed away, please let us know to try to save us that embarrassment and some money, if you will, when we're sending a letter to a wrong address. So if you have any particular friends or businesses or anybody that you are more comfortable talking to, please let us know, and we'll be sure that they're on your list. Sometimes it's easier to talk to people that are in your circles, and I'm not real familiar who all of you run with. So let me know if there's someone in particular you'd like to talk to. We're shooting for calls to be made after the 4th of July. So you don't need to worry about that for the rest of this month. And we want you to enjoy your holiday, so please don't worry about this until after the 4th. And Sierra and I will also email you to give you the go-ahead. So please don't worry about this until you hear from us again. And I believe that's all I've got for the slideshow. I just really want all of you to know that we're so thankful for all that you do for us. You truly are a huge piece of this puzzle, and I'm just so grateful. I'm starting my 2nd year and couldn't do it without each and every one of you. So,
Well, we're all very, very grateful. I'll just throw it out if any of you have any questions for Amanda or for me, right now or whatever, just, let us know. But it's a ton of work that's done by staff, but, we're kind of the last milers that go out and do the ask. And if you truly believe in the cause, it's a lot easier to do it. And I'll also say it's a lot easier to make the ask if you've already done your own giving. And so I would highly encourage each and every one of you guys to consider. And no, I'd actually say I would like each and every one of you to make a gift to the foundation. Again, it makes the sell easier, and if you believe in the cause, you understand that it's for a very good purpose. So
Yes, we are here for our community and the health of our community. So that's all I have today. Does anybody have any questions for us now? Okay. Well, have a great rest of your day. Enjoy this wonderful weather.
And if you're a guy, happy Dad's Day.
Yes, right. In a couple days. Yeah. And we'll be talking to you soon. Just thank you so much, you
Thank
guys.
you.
Thank you both.
Care.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye-bye. Have a good week.